Ako actually, hindi eh. Hindi naman ako talaga, ayoko talaga nursing eh.
Parang si Mama Padre, yun din yung sagot niya.
Yeah.
Good morning, ma'am.
Okay.
Thank you for allowing me to interview you today to accommodate me such a short notice. We're with Miss Bong Villasencio, one of our nursing supervisors here at the Lang Center. So first, ma'am, tell us first about yourself, your first year educational background.
Okay, so my name is Belinda Baviera and I'm now Mrs. Villasencio. I finished my nursing as a general graduate in nursing in Chinese General Hospital, and after a year I finished my Bachelor of Nursing. We are the first batch of the new curriculum of BSN, so that was 1980. So my BSN, I finished my BSN in 1980, 79 as GN, as graduate in nursing. And then my postgraduate course, I started first at Pamantasan in Manila. For how many years? Been there, but I finished my master's degree in PCHS. During that time, there was no controversy regarding the board exam about the school. Since then, to be fair, it depends on the students naman yung school. So, happened the school. And as of now, I'm on my 12 units of doctoral degree, but I'm pursuing to study my doctoral degree by next year. Maybe in your school. Maybe.
So how about your work experience? Where did you start working?
My work experience, the first time here in Lang Center. My admission here since 1982 as a staff nurse for 5 years. And then after 5 years, I was promoted by a nurse, head nurse in medical surgical medical surgical ward. And then for 3 years in the area, I was promoted in nursing research, and I was assigned to research. So we have been doing some research work in this institution, like medication error. That's why we have our medication sheet. In the clipboard, we separate our medication sheet from the chart. And then the spiritual care for the terminal ill patients. So they found out that the nurses has no background on the spiritual care. And then another incident is that we use the incident report also as the basis of part of the medication error.
So, what inspired you or motivated you to pick up nursing?
Actually, nursing is not my first love. My first love would be a psychologist, something like that. Kasi in our family, kasi you have to take nursing, a doctor, and a lawyer. But I don't want a lawyer, the three. But then, no choice to obey the parents' will, so I have to took up nursing.
So, did you really want to be an adult health nurse or a pediatric nurse?
I don't have any choices because during the time 1982, Lang Center has a mixed clients. We have the pediatric during the time 1982 up to 84. Then, when the PCMC nagawa na, so they moved Pecha and patients sa Lang Center, so they moved to PCMC. Well, I prefer now adult than Pecha. Kasi pediatric, you do not know yung mga ano nila mga complaints.
Adult patients are much more easier.
Yes,
when you started out as a staff nurse, did you dream or did you want to be a nurse manager?
Of course. That is one way of the career path of a nurse. So when I was a staff nurse, we have during the time, the nursing then before has a dream. We said within 5 years we have to be promoted, so it was granted. So after this, we have to move on to training, to attending the convention, training programs, and management. That's what makes you to become more, have an adequate or idea to be a good manager.
So, as a nursing manager or supervisor, what are can you tell us your everyday tasks?
Everyday tasks to check the staff nurses, the head nurses in their area, carrying out the orders, especially carrying out orders, the way they decide. The decision making is very important to me when it comes to the head nurses, when it comes to decision making, and how she managed the area, how she to react some problems, some encounter na head nurse sa ward, especially sa mga doctors, especially na nami-miss ang order, and then how she handled the staff, especially their behaviors, their attendance. Yeah.
So, how would you yourself, how would you describe your managerial style?
Me, well, I have to be on 50 in the autocratic, and then 50 on, the democratic managerial. So I think that would be more, well, you cannot say it is 100% good. May loopholes pa rin sa 50-50.
So, why did you choose that way of managing or that style?
I think now, kasi the nursing staff is so different. When we were a nursing staff before, we are afraid of legalities. We are very cautious about our moves. Ngayon, the nurses doesn't care. Doesn't care about the legalities, as if I don't care, or I don't know. It is a way of attitude and the skills of the nurses. It's a different now.
The culture is
a different. Siguro maybe somehow is in the education also.
So, how do you motivate your subordinates, your nurses?
Well, I encourage them to go on their master degree. And then, especially like you, talagang you go to your master out. You have time to go to school, go ahead. Kasi that is one way of teaching them to be mature. Especially, kasi if you don't encourage them to go on master out or whatever, postgraduate course or the convention, they will not know. Kasi the responsibility, accountability of the staff nurse, hindi nila de-develop.
So, they will just be confined in the one.
Yes, just work, and then after carrying orders, after talking to your patient's relative, goodbye, nothing.
So, how about mentoring? Have you handled nursing students?
Yeah, yes, many. From the FEU from Manila, College of Holy Spirit of Manila, Negros, local government in Negros, and also in somewhere in also in Negros, also Visayas, also in Visayas.
So how much autonomy do you give your nursing staff or your subordinates when it comes to decision making?
I'll give them 50-50 also, especially the head nurse. The head nurse should, we always tell head nurses na kanilang duty is 24/7, even though they have their own duty. Kahit din tayo, when we reach on the nursing head nurse up, ang duty mo is 24/7. So you have to teach also, you have to motivate your staff nurses, even though you are on off duty, you are also 24/7.
You're still working.
Yeah.
So, you would say that you're very hands-on when it comes to your subordinates because you don't let how about, can you tell us about a professional event or something that you became proud of as a manager or as a leader?
Yeah, professional advancement, no? Especially, no? When I was a staff nurse, there's one supervisor encouraged me also to attend, like the convention, the seminar, which handled by the PNA, the CNGP. Those association helps me a lot when it comes to how to manage, no? Especially the PNA, the ANSAP. They teach us managerial. So yun, natuto ko doon dahil to go on mature thinking, nagiging idealistic ka doon na ganyan din. Mga nurses natin, they have the career orders, mga ganun ba. Accountability nila, responsibility, simula pa ng nurse 1, alam na agad nila yung sense of accountability.
So, next, have you ever had to make a decision regarding a certain event without really knowing what happened?
No.
So, you really have to
investigate.
To know the facts.
Yes. There's a one nurse. Medication error. So, one medication error underdose the medicine. So, I do some investigation doon sa medication error niya. So I found out na she assumes always that is the fault of the nurse, always assuming that medicine stock is this, hindi niya correct. So we recommend for her dismissal or silent exit.
So how do you deal with an employee who's not going to broke a policy, for example, one of them is called absence without notice, some things like that? How do you deal with an employee who does that?
Well, I told them it's not my it's not my rules, and hindi sa akin talo yun, no? When it comes to, I told them na if you have many distinct na no notice of absence, everything, if you have your performance evaluation unsatisfactory in 3 quarters, you are now you can go and exceed it. No question asked.
How do you deal with an employee who's not very, for example, you have a staff who's not very open in communicating with you?
Well, I'll try my
very
best.
hard to reach.
Yeah, I'll try my best to be open to her. What's her problem? Do you want to share something? Or yeah, so I'll tell her, oh, magsalita ka dyan. Paano mo nalaman yung mga problema mo kung hindi natin pag-usapan? So I'll just talk as na lang. Hindi somebody here.
So, can you tell us about the time when you have had to deal with an irritated employee or an irritated doctor because of their shortcomings when it comes to the nursing?
Irritated doctors? What do you mean that?
For example, lang first sa patient, an irritated patient na parang nagwawala sa
yeah. Oo, hindi natin maano yan may iwasan sa mga ganun situation, especially nowadays because of economic reasons. Kasama din yung kaya sila irritable sa babayaran din nila. So you have to calm down also. Make sure of yourself to be calm down. Huwag ka makikisabay sa kanilang pagiging irritable. Meron din tayong mga shortcomings, so we have our own weaknesses. So kapag ganyan, I want to be sure to make friend with this patient. So you make lambing to your patient. Ano ba ko yun? Sa touch, you have to touch your patient. Kapag irritable, you have to touch your patient. Kasi maano na yun may himas mo na, mawawala na yun. Hello, bakit po? Ano po problema? Lagyan na yun. Para at least ano na, susubside niya kunti-unti. Meron pa rin, pero hindi na gano'n. Yung may pikisabay, sige po, you have to calm down first to patient or relatives. Gano'n.
So, could you tell that yung style is very effective?
Well, for me, yes. I think so. Kasi kung hindi ka, bakit kumana ng nursing? It's a service eh. It's a service.
How about, did you ever had a time when you disagreed with your superiors?
Yeah.
Decisions?
Meron.
So, how did you handle that situation?
Well, I have to tell her I don't like it. I will obey it, but I don't like it.
So, you're very tactful and
Yeah. I am so open, whoever you are. I will tell you what is inside, but I will obey it. Sa akin kasi, it's a one-way of two-way communication to understand your boss, and the boss will understand who you are, how you handle it. For example, I'm handling 2A2B, the switch room. So, we make an rounds with our department head, si Ma'am Laura, with the head nurse. So, sabi niya, siya yung supervisor masyadong halos ko. Minsan, sobra-sobra daw ako mag-halos na. Minsan, gumagawa na daw din ako my own policy. Because I want these nurses to be, I want these nurses to be mature. That's why, medyo mahirap din.
So, have you ever had problems in getting your nursing staff to obey you or some of your decisions?
I don't think so. I don't think so. Kasi these people are already in nurse 1. Then become nurse 2. Yun, mahirap yun. Iba ang ano mo dyan eh. When it comes to nurse 2. So your decision much more tactful, saka maging ano ka dyan, autocratic ka rin.
Pag nurse 1 kasi
you have to adjust. Masulubi pa, you have to adjust. But you have to be autocratic also.
So, let's go to nursing budget. Have you ever had a role to play in managing the nursing budget?
You have to design the cases, the directed diseases, how much it will cost. For instance, like Brocalas, we have that nursing budget. And then sa operating room, sa recovery room, I was a head nurse in the recovery room. I was given a task how much the patient will undergo in VATS, thoracotomy, how will be spent, the costing, yeah.
Vis-a-vis the profit.
Yeah, yes. And then in the ward, what do you think by square foot ang room? And then what are the amenities? You're going to add on or less the amenities?
So how about keeping up to date with the nursing profession? How do you keep up to date?
Well, up to date, I invest myself sa mga ganong klaseng programs, especially when there is an ANSAP managerial. I just attend the ANSAP managerial course. It cost me a lot. It's a big money. 7,000 is a big money. That's only 1 week, 7,000. But 7,000 you will learn. Hindi yung panghihinayan. So you have to invest also yourself when it comes to upgrade your education. Yung huwag ka maging stagnant. Yung bang, yun din na sinasabi ko din sa nurse sa inyo. Na you have to upgrade yourself.
So have you ever had a role to play in establishing department policies?
Here we have the nursing policies. We do our nursing circles here. We do some policies. So mostly the nursing policies were made by the supervisor and then up, not supervisor lang, the supervisors up. The nursing policies you're now receiving coming from the supervisors up.
So what other projects do you do aside from being a nursing supervisor? Do you have any other extracurricular?
Yeah, I have.
activities?
As of now, I am a candidate as a governor in our local chapter in Quezon City, Marikina, for the governor of PNA. And also, I'm joining with other group like the Catholic Nurses Guild and other also in ASAM. There is a training program.
How about programs here in the hospital?
Well, it depends on them. If they're going to invite me to have a lectures, yeah. And then I give some ideas, ganyan.
So, last question na lang. If you ever had one thing to change about the nursing service here in our own hospital, what would it be?
What do you think so?
I think, yung attitude ng nurses. Because it's different in culture kasi siguro younger generation.
One more.
Ayun.
Attitude. Kasi, tsaka yung sense of responsibility nawawala. So, number one is the sense of responsibility. Second is the attitude. Kasi, some of the staff nurses were hindi natin maano sa government care of these people. Kapag naging permanent na sila sa attitude problem, the first few months they're good. After that, it's an attitude problem. Kita mo yun sa area mo At least alam ko ikaw, alam ko kung saan ka nagaling. Wala kang care of. And yung kabatch mo, madaming care of. Nung pumasok, di ba? Sabi ko, talaga? Wala.
Meron akong binanggit, ma'am, pero feeling ko na di ako tinulungan.
Hindi ka tinulungan. Oo. It so happened, nag-top ka ng At the same time, galing ka din sa UK. Hindi mo katulong.
So, that ends my interview, ma'am. Thank you very much.
Okay, thank you. Off na?
Thank you.
Oh.